One of the advantages of Turning Point Family Care is not only do we empower our staff and our leadership to make the best decisions for the agency, we also encourage our clients to participate in client rights committee meetings as well as quality assurance meetings so that they have a voice in the decisions that are made within the company, as well as they can also let us know how they feel as well as what's going on out in the community. My job at Turning Point Family Care is to also ensure that the staff is fully trained, prepared, and provides excellent customer care and clinical care to all consumers.
Hi, my name is Dr. Jenny Byrne. I am the Medical Director for Turning Point Family Care. I'm a psychiatrist, and at Turning Point I have many different roles. Some of what I do at Turning Point is to help the clinical staff develop their skills, make sure we're providing the best services possible for our clients. I do that with supervision and monitoring. I also help the leadership team with strategic planning for the future, again looking at compliance with all the rules and regulations and making sure that we are working hard to improve our quality in the future.
Turning Point Family Care strives to provide excellent quality services for children, adolescents, and adults with mental health, addictive disorders, or other behavioral or emotional needs. We also partner with families, individuals, and our community to ensure greater health and safety, personal choice, and the achievement of outcomes for people with unique needs. I believe it is our commitment to listen, understand, and individualize services and supports for people that sets us apart from other agencies. Turning Point employees are very quick to tell you that we have a supportive, ethical, and friendly workplace in which we all take an active role in creating.
Medication management is something that sometimes patients feel very helpful in conjunction with other services like therapy or having therapists come into your home. The benefit of having a medication evaluation is that we can talk about your specific symptoms that you have and then go over all the risk and benefits of medications. And not everybody needs medicine, but some people do, and we'll talk about that. And that's the benefit of being at Turning Point, where you have access to all of the things that you may need. When picking a provider, you want to make sure it's someone that you're comfortable with, someone who's going to listen and make sure that your needs are heard. But it's also important that they have a good relationship with your primary care physician so that they can coordinate all of your services. But I really like working with a CAVA like Turning Point, because that means that the state said they're doing a good job, but also because I have availability to talk to your therapist, and all the other services that you may need I can recommend, and they're all under one roof.
Other ways that we involve our consumers in the overall infrastructure of Turning Point Family Care is through consumer surveys, through quality assurance phone call, parent night, as well as we also invite them to join many of the committees that we have here within the agency.
As Clinical Program Manager, I provide clinical oversight and supervision to the providers here at Turning Point Family Care. As a marriage and family therapist, I utilize a biopsychosocial approach in the clinical work we provide at the agency. As a clinician and family therapist, it is imperative to engage the whole family in the treatment process.
Sure. I've been a licensed clinical social worker since September of last year, and I've been an outpatient therapist actually since 2010. I've been an employee here as a therapist since February of 2012. And I think as a therapist, it's key to have and practice good professional and ethical values, to also respect diversity, since we do work with a lot of people with a wide variety of different backgrounds, whether it's religion, race, gender, and the like. And also honoring and respecting the person's self-determination. If, respecting their wishes when they want to end treatment, when they want to make changes in their treatment process, and overall getting them and keeping them engaged in the overall treatment process. And in that way, that will make them feel like that they have a stake in their own treatment process, and it keeps them motivated, keeps them focused, and it makes the people that we serve and their families much more valued, and that makes a difference overall.
As part of my role as a QP and intensive in-home team, my job is to coordinate care, provide referrals for services that family need, and also support. It's important to be cultural competent with our families and see them as unique individuals. And mostly with our Hispanic population that's been growing and really don't needing the services. So at this point, I work as much as I can for them, and I advocate for as much as I can for them. Being myself Hispanic, I know how it is hard to get services. So just working with them makes me proud of what I'm doing here at Turning Point. Como parte del programa de Turning Point intensivo en la casa, nosotros trabajamos con la familia, proveemos servicios para ellos referidos para servicios que necesitan. Somos culturalmente competentes, trabajamos con las familias hispanas buscándoles ayuda en lo que necesitan para sus niños. Siendo yo hispana, sé lo que luchan los hispanos aquí en Estados Unidos y lo que necesitan. Mi trabajo es importante para ellos y trato de hacer lo mejor que puedo con ellos.
Here at Turning Point, we collaborate with Johnson County Mental Health, the Durham Center, Wake County Human Services, DSS, the school system, the Department of Juvenile Justice and Delinquency Prevention, psychiatrists, primary care physicians, other agencies and therapists that support our families, residential placements, supportive employment facilities that also provide educational services, the court systems, guardian ad litems, and any other natural and community supports that help our families.
One of the ways we strive for excellence at Turning Point Family Care is to provide evidence-based therapy to our clients. One of my roles is to stay on top of all of the latest research and evidence-based medicine. That includes medical as well as psychiatric issues.
They help me with my housing, they help me with doctor's appointments, they help me with personal things that normally you don't really talk to strangers with, and they're very reliable on the information they give you, and they help you with scheduling appointments, getting medicine, and getting you back on your feet, which a year ago I was a very different person from now because of Turning Point and their services, and they make me feel better by the service I'm receiving now and the service I'm probably going to receive in the future. I mean, I really like Turning Point. I think it's if you're having problems, I think it's a very, very, very good company to come and see or come and talk to about services, or get on one of their service plans, or however you see fit for your personal needs. So, I mean, that's a little bit of highlight of what I've been through. I've been through a lot of changes in my life. I kind of went from nothing to something in my life in the past year. I feel better about myself. I dealt with in their PSR thing. I was in that, and that was a very good program.
One of my goals for Turning Point Family Care in the years to come is to provide the highest level of care possible. And that means behavioral health issues, but it also means medical issues. So we're working on a lot of programs for medical monitoring to make sure that people are medically well, and that we are coordinating care with primary care, other doctors, other providers in the community.